Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Aversive Exercises for Suicide and Alcohol, Part 1. In this type of problem, we also have very few exercises. In this case, we sing with the Aversive Suicide Hospital. Suicide Aversive Hospital. I want you to visualize yourself in one of your suicide attempts. You have just thrown yourself out of the window of your house. You have fallen to the ground. Your whole body hurts, everything except your legs. You have tried to kill yourself and have only managed to become a paralytic. You are now in a wheelchair for the rest of your life. You're much worse than before. You have stopped controlling your bowels. You relieve yourself. You smell very bad. At home, they are tired of cleaning you. Your family decides to put you in a nursing home, to clean you and take care of you, so that they can clean you and take care of you. There you get a strong depression. You become very degrading because nobody visits you. Now you're worse. You can only move your head. They have to give you food, drink. You relieve yourself on yourself. They only clean you at night before going to sleep. You're dirty all day long. You're dirty all day long. You're dirty all day long, full of poo and pee. You smell very bad. Nobody comes near you. They keep you isolated in a room, withdrawn from others. Nobody visits you, not your family, not your friends. They were so fed up with you. They stopped visiting you. Now you're alone. You can only shake your head. All this for the foolishness of wanting to commit suicide. From now on, you're going to fight to life. You're going to fight to life. You're going to fight for your family, for your friends, for yourself. You're going to fight for happiness, for living together. From now on, you want to live in peace, in harmony, with joy, with happiness, with a lot of happiness. From now on, you totally stop thinking about suicide. From now on, you stop thinking about hurting yourself. From now on, there's only room for positive thoughts in your mind, in your way of thinking. Now you like to live. You love to live. Now you feel alive, with a lot of illusion, with a lot of hope. Now you're happy. You feel very happy. Enjoy life. You deserve it. You deserve the best. You deserve it. Aversive alcohol. Aversive exercises for alcoholism are very effective, although for this type of addiction, we very strongly recommend the patient to go to Alcoholics Anonymous for further therapy. For us, alcoholism is the worst of all addictions, hence the importance of treating this addiction from several fronts. Alcoholics Anonymous treatment combined with our therapy helps a lot. We have to take into account the seriousness of this addiction, as we live in a society where practically everything that is celebrated by toasting and drinking with an alcoholic beverage. We must also consider how cheap the cost of this addiction is compared to, For example, cocaine. For very little money, any alcoholic beverage is readily available. It is also worth considering that the mere fact of visiting a relative or a friend, he or she easily appreciates the visit by offering a drink. This makes it very easy for the alcoholic to obtain alcoholic beverages, even for free. Aversive, sweet-tasting alcohol. I want you to visualize yourself at home. You are nervous and you feel like drinking beer. You go to the fridge and get the beer. You pour yourself a glass and start drinking. You spit out the beer as it is sweet, very sweet, disgustingly sweet, like they put a lot of sugar in it. You decide to get another bottle of beer, and the same thing happens. The beer is sweet, very sweet, tastes in a very sweet way. You spit it out. It is disgustingly sweet. It looks like syrup. Then you pick up a bottle of rum. We'll always talk about the alcoholic beverages usually ingested by the patient, being able to generalize the aversion, in this case sweet taste, to all alcoholic beverages. You start to drink and you realize that the rum is even sweeter than the beer. You spit it out. It is disgustingly sweet. The same thing happens with all the alcoholic drinks you find at home. So you decide to go and get a drink outside the house. You go to the supermarket. You go in and buy a liter of beer. You go outside in the car. You get ready to drink. As you drink, you suddenly spit out the beer. It tastes distinctly sweet, very sweet, sweeter than the beer you had at home. You go outside in the car. You get ready to drink. As you drink, you suddenly spit out the beer. It tastes distinctly sweet, very sweet, sweeter than the beer you had at home. You throw the beer on the ground, angry, screaming. You notice people are looking at you and you feel embarrassed. You leave the place with people's eyes on you. You're driving and you see a bar. You desperately enter the bar and ask to be served anything, as long as it has alcohol in it. The people there look at you without stopping to look at you, since you have rushed in and asked them to serve you anything, as long as it has alcohol in it. You feel watched and you are embarrassed. They serve you the drink. You grab it desperately and put it in your mouth. The same thing happens to you. It tastes very sweet, distinctly sweet. You spit it out and throw the glass on the floor in a rage. The people in the bar look at you, dumbfounded. You feel ashamed, very ashamed. You run out of the bar without paying. The waiter chases you. You get in the car and go home. What a shame you had. You looked like an alcoholic screaming for a glass of whatever. Now you realize that you are dependent on alcohol, that you are an alcoholic. You go desperately to a friend's house. You go in, she sees you, very nervous, and offers you a glass of cognac to calm you down. You drink it and feel that it is disgusting. When you drink it, you feel that it is distinctly sweet and you spit it out. From now on, every drink you have that contains alcohol will taste sweet, very sweet, distinctly sweet, as if it has a lot of sugar in it. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Aversive Exercises for Alcohol Part 2. Remember read the description of this video, where you can find a link to free training classes on clinical hypnosis, and also you can download several free ebooks. If you have any questions, add them in the comments area. On this topic and many others, we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.